Greetings, my name is Dr. Sandra Cabot. This presentation is about thyroid problems and how to solve them. We'll be looking at underactive thyroid, overactive thyroid, enlarged thyroid, and then at the end we'll be sharing some interesting case histories, which are rather long, but you don't have to watch the whole presentation in one go. But I'm sure it will be very helpful if you have thyroid problems. So the thyroid is a butterfly-shaped gland which sits here in front of the windpipe, and it secretes thyroid hormone which travels around the bloodstream to every cell in your body, goes inside the cell and stimulates the mitochondria, these little energy factories here inside your cells. So if you don't make enough thyroid hormone, the mitochondria won't be stimulated and your metabolism will slow right down. So you will find yourself having a lot of problems. So we're going to look at some of the symptoms that can occur. Thyroid hormones have a profound effect throughout your body. They affect your energy levels, your heart rate, cholesterol, your skin and hair, muscle strength, body weight, fertility, bowel function, your cognitive function, body temperature, and your metabolism. So you really need your thyroid gland to be healthy. Otherwise, you can have a wide range of problems. It's interesting to look at how the body regulates the production of thyroid hormone. So here we have the thyroid gland. So how does the thyroid gland know how much thyroid hormone to make? Well, messages are sent here from the pituitary gland. So the pituitary gland, which is attached to the bottom of the brain, it sends this messenger hormone called TSH, which stands for thyroid stimulating hormone, through the bloodstream, and it goes to the thyroid gland and says, come on, make more thyroid hormone. And that stimulates the thyroid gland to make thyroid hormone in the form of T4, T3, and also calcitonin, which is another hormone that controls our calcium. So it's very finely tuned, and then if the thyroid gland is making enough thyroid hormone, that feeds back onto the pituitary gland, and it knows how much thyroid stimulating hormone to send back. So it's a feedback cycle, and it works extremely well until it doesn't. And that's what we're going to look at today, how we can overcome problems in that feedback cycle which regulates this very important thyroid gland. Well, the most important thing to check your thyroid function is a blood test. This is very, very accurate. And you can see here the normal range of thyroid function. We check TSH, which varies between 0.27 to 4.3. And if that's too high, that means that your pituitary gland is trying to stimulate your thyroid more. So we would suspect that your amount of T3 and T4 is going to be low. So the normal range of T3, as you can see here, is up to 8, and the T4 is up to 22. So you don't want to be at the bottom here. You want to be in the middle. You want your T3 to be about 6 would be good, and your T4 to be about 16, 18, somewhere in the middle of the normal range. If it's at the bottom of the normal range here, then it's likely that you have a problem. The other thing we check is the amount of antibodies in your blood. So these are produced by your immune system, and you don't want too many of them because they are like little missiles and they will attack your thyroid gland and destroy it. And indeed, the most common cause of thyroid disease is an autoimmune disease where we have a lot of these antibodies and they destroy the gland and it becomes underactive. And that's called Hashimoto's disease, named after Dr. Hashimoto. And it's the most common autoimmune disease in the world, very, very common. And sometimes people have it years and they don't know because nobody checks their level of antibodies. Okay, another problem we see with the thyroid gland is enlargement of the gland, which is known as a goiter. So here you can see a mild goiter, and here you can see an extreme goiter. You won't see this in Western countries, but I have seen goiters like that in India, because I worked in a missionary hospital in India for 6 months, and it was in the Himalayan foothills, which is far removed from the ocean, and so the soils were very low in iodine, so the thyroid gland would swell up to try and trap more iodine from the blood, and people would end up with these huge goiters. Very, very distressing for people. The other thing that we see is lumps in the thyroid gland, and they are called nodules. And here we have a nuclear scan showing a nodule in the lobe of the thyroid there, and that is a hot nodule. We call that hot because it's producing too much thyroid hormone. That's why it shows up so bright in the scan. We can also have cancer of the thyroid gland, and we can have an absent thyroid gland if it's had to be removed surgically. Now, the most common thyroid condition that we see is that of underactive thyroid. We call it hypothyroid, and the most common cause of that is Hashimoto's autoimmune thyroiditis. And what causes the underactivity is the thyroid gland becomes damaged and it can no longer produce adequate amounts of thyroid hormone. And these are the typical symptoms you'll get. Everything slows down because the cells are not being stimulated by the thyroid hormone. So typically we'll get fatigue, you'll put on weight although you're not eating anymore, you may have depression and brain fog, dry skin, hair loss, fluid retention, feeling cold, you can't regulate your body temperature properly, you may have muscle weakness and aches and pains, you may be constipated, you may have changes to your fertility and your menstrual cycle. So you can see widespread symptoms, and it doesn't sound like much fun, does it? But thankfully we can treat it easily. So one thing that I often recommend is thyroid health capsules, because they contain the selenium and iodine and zinc and vitamin D. And the thyroid health capsules can actually help your thyroid hormone tablets to work better. So if you're taking thyroxine and it's not working very well, sometimes the key is just to take these little thyroid health capsules. We can also lower the level of the destructive thyroid antibodies with the thyroid health capsules, and we can improve the health of the thyroid gland tissue, and we can improve the function of the thyroid. So very, very beneficial, the nutrients in the thyroid health capsules. Okay, what about overactive thyroid? Well, that's obviously we're going to get symptoms that are opposite to the underactive thyroid, aren't we? Because everything will speed up. You'll be going on fast forward and you'll lose weight even though you'll be eating like a horse. You'll have a voracious appetite. You may be nervous and anxious. You won't sleep. You'll be exhausted because everything's going so fast. You may get a fast heartbeat, palpitations. You'll overheat, change in your menstrual cycle, infertility, muscle weakness, tremor. You get a shaking tremor in your hands, and you can have problems with your eyes. They may become more prominent if the disease attacks the eyes. So what can cause overactive thyroid is if you have a multinodular gland and some of the nodules are overactive. They're producing too much thyroid hormone. They're doing their own thing. They're no longer regulated by the pituitary gland. Another common cause is Graves disease, which is an autoimmune disease where your immune system makes antibodies that stimulate your thyroid too much. So that's opposite to the Hashimoto. So we can test for those antibodies if you have a Graves disease autoimmune problem. Now, a lot of people think that iodine causes an overactive thyroid, but this is a very rare cause of an overactive thyroid. The most common cause is a hot nodule, an overactive nodule, or Graves disease, which is autoimmune. Taking too much iodine rarely causes an overactive thyroid. I've never seen it in my 50 years of practicing medicine. So iodine is very, very important for the thyroid, but if you have an overactive thyroid, it's important to check whether you're iodine deficient before you supplement with iodine. So the best way and the most inexpensive way to check if you're iodine deficient is with a urine test, and we check for the concentration of iodine in your urine, and the normal concentration should be over 100. 50 to 99 is a mild deficiency, a moderate deficiency is 20 to 49, and if your level is less than 20, you have a severe deficiency. So even if you have an overactive thyroid, you're probably going to need iodine. You can check with your own doctor, but if I had a patient who was iodine deficient, even though they had an overactive thyroid, I would give them some iodine to bring it up to the normal range. And also treat the cause, which would be the Graves disease or the hot nodule. Other thyroid conditions, well, we mentioned goiter, which is an enlarged thyroid, and that could be underactive, overactive, or normal function. It just means that it's enlarged. We could just have nodules, and you can see here there's a nodule there, which is being biopsied. So people with nodules, they need to have a scan of their thyroid and see a specialist who will organise a biopsy of the nodule to make sure it doesn't have cancer in it. Most nodules are benign and can just be followed up and biopsied, checked that way. But they do need to be followed up, have a scan every 6 to 12 months and make sure that they're not changing and do not have any cancer. And it's important to, have a feel of your thyroid, just feel around and see if you can feel any lumps in it, and ask your doctor to do that as well. So these are the thyroid health capsules which I actually formulated, and they're designed to improve the health of your thyroid tissue, reduce the antibodies that cause autoimmune thyroid disease, provide essential nutrients for the thyroid gland to manufacture thyroid hormones, and improve the conversion of thyroxine into its active form of T3. And there are references to show that that conversion is dependent on the nutrients that are in the thyroid health capsules. Okay, so what have we got in the thyroid health capsules? We've got organic iodine, we've got selenium. Selenium is very important for the thyroid. You won't convert the thyroxine into the active form without selenium. It's a selenium dependent process. If you're selenium deficient, your thyroid function will not be good and your thyroid tissue will not be healthy. Vitamin D is also important for the thyroid because it's anti-inflammatory, and zinc is important for thyroid function and for the thyroid hormone to get inside your cells. Now be aware that most multivitamin supplements do not contain adequate amounts of iodine, selenium, vitamin D for optimal thyroid function, particularly if you have a sluggish thyroid. So if you have a slightly sluggish thyroid and you may not even need thyroid hormone, you want to get your own gland working better, you may just need to use the thyroid health capsules, 1 or 2 capsules daily, and you'll see your blood tests improve after 4 months, that your thyroid function is back to the higher limit of the normal range. And be aware that if you're allergic to inorganic iodine, such as we use in radio contrast dyes for x-rays, that is not a contraindication to getting iodine in your diet or in supplements, because if you didn't get any iodine in your body, you actually wouldn't survive, because without thyroid hormone you cannot survive, and thyroid hormone is made from iodine. Now, some people will be taking thyroid hormone replacement, and some people will say to me, oh, I really want to get off this stuff, I'm on this thyroid hormone replacement and I'm on it for the rest of my life, and I don't want to be taking a drug for the rest of my life. And I reassure them it's not a drug, it's a hormone. It won't hurt you. It's completely safe. And some people will need to take it for the rest of their life because they may have lost their thyroid surgically, or they may have had such bad autoimmune disease that the antibodies have destroyed their thyroid gland to such a degree that it can never make adequate thyroid hormone again. So the most commonly prescribed form of thyroid hormone is thyroxine, and it contains 4 molecules of iodine. T3, which is much more active in the body than thyroxine, contains only 3 molecules of iodine. Some people find that they are intolerant to the synthetic thyroid hormone, and they get symptoms and they find it hard to balance the dose, and they do better on porcine thyroid extract, which comes from whole thyroid gland from pigs and is bioidentical to human thyroid hormone. And that's quite effective, and indeed that is all we had before we were able to synthesize thyroid hormones in a laboratory. All we used to prescribe was the pig's thyroid extract, and it worked quite well. So T3, sometimes people will take T3 tablets as well as T4, and T3 is known as triiodothyronine. It's produced in the thyroid gland, but some people don't produce enough, and they don't convert the T4 to the T3. So they take a supplement of T3 known as Cytomel in the USA. It's also known as tertroxin in some other countries. And for some people, the T3 makes a big difference. They may just be taking the T4 and they still have symptoms, not feeling energetic, can't lose weight, foggy brain. We add a bit of T3 to their T4 and bang, they feel completely normal. But T3 must be taken more often than the T4 because it only lasts for 8 hours. But it's worth considering if you're not responding to the thyroxine tablets. Porcine thyroid extract, it does require a prescription. I mean, some people do buy it on the internet, but do you really know what you're getting or how much you're getting? Because we need to regulate the dose of thyroid hormone, even if it is the natural pig's thyroid, because it is an active hormone, and if you take too much, you could get side effects such as a racing heartbeat and insomnia and things like that. So it's important that you get a prescription for the porcine thyroid. We're going to look at a really interesting case history of mine about thyroid disease that was hidden. The patient's name was Diane, and her case illustrates that it can be hard to diagnose thyroid disease unless you really know what to look for. So Diane was a 55-year-old postmenopausal woman who complained of symptoms suggestive of underactive thyroid. She was tired, she was puffy, fluid retention around her legs and her eyes, unwanted weight gain, her vision was deteriorating, and she was constipated. Now, her doctor had ordered blood tests to check her thyroid gland function, and her tests revealed an essentially normal function. But I said to Diane, well, something's going on because you've got the symptoms of an underactive thyroid, and even though your doctors told you your tests are normal, I suspect that your thyroid function is not. So I asked her to measure her basal body temperature in the mornings and keep a record of this, because typically the basal body temperature will be too low in someone with an underactive thyroid. Now, here are a copy of the results that I then ordered, and they are very interesting because they show the cause of why her thyroid is sluggish. So here's her results, and here's the normal range. Now her results show a T3 of 2.46, which is right at the bottom here of the normal range of 2.5 to 6. Her T4 is 10, the normal range is 8 to 22. And her thyroid stimulating hormone is 3.22, which is within the normal range of 0.3 to 4. So you can understand why her doctor told her that her thyroid was still looking fairly normal, and her problem was not due to her thyroid. However, the doctor did not check her level of antibodies. That's very, very important, because antibodies attack the thyroid and damage the thyroid. So you can see here that Diane's antibodies are way high. Hers is 1600. They should be less than 100. That's the normal range, less than 100. So we can see that her T3 is just a little bit low, but not low enough to, really have a high index of suspicion. What we really need to go by here is the high level of antibodies. Okay, so these were really damaging her thyroid gland, and unless we treated this, her thyroid gland would eventually completely fail. Now, she was not happy just to sit and wait till her thyroid gland became more underactive. She was not feeling well. So even though her thyroid stimulating hormone level was normal, and therefore her doctor didn't think it necessary to give her any treatment, I did. And I suggested to Diane that we should first try to reduce the level of the antibodies attacking her gland. And if we could do that, her own gland may discover and recover, so that she would not require thyroid hormone. We just needed to get those antibodies down. So this is what I gave her. Some thyroid health capsules, 2 a day, to provide selenium, iodine, zinc and vitamin D to lower her antibodies. I told her to go off gluten and cow's milk, because these can sometimes be incriminated in autoimmune disease, particularly when the antibody levels are very high. And I wanted her to boost her antioxidants. I wanted her to start juicing. So she was happy to do this. She tried the program for 4 months and she felt a lot better. And this was without any thyroid hormone. Indeed, she lost 8 kilograms in weight. Her bowel actions became normal and she was no longer bloated. And when I retested her antibody levels, they had come down to 500. And remember, they had been much higher at 1600. So I was quite pleased. Now, Diane was still troubled by some fatigue and puffiness, and she really wanted to try some thyroid hormone. So I said, okay, not a problem. So she wanted to try the natural porcine thyroid extract. She thought it would be more natural than the synthetic form. I said, sure, not a problem. So I started her on a low dose of 32.5 milligrams a day. And this is made up by a compounding chemist. And the equivalent is 55 milligrams of natural thyroid extract is equal to 1 grain, which is equal to 100 micrograms of synthetic thyroxine. So Diane continued with my nutritional program, the thyroid health capsules and the porcine thyroid hormone for 6 months with an excellent outcome. Her antibody levels came down to only 200 and her level of T3 was completely normal. She was totally free of symptoms. So the take-home point for this is, if a patient has symptoms of thyroid disease, the full range of tests for thyroid function must be done, including the thyroid antibody levels and a basal body temperature chart. It is vital to treat thyroid gland dysfunction, even if it's very subtle, to avoid the progression of the disease and prevent the destruction of the gland. If simple follow-up and observation is done and no treatment is offered, it is not good enough, because even subtle degrees of thyroid dysfunction can have a huge negative impact on a patient's quality of life. Let's look at another interesting case history, that of Natalie, who actually suffered with an overactive thyroid gland. She'd had this problem for 2 years, and this had been caused by Graves disease, which is autoimmune. Now, Natalie had the classic symptoms of an overactive gland. She'd lost a lot of weight. Despite a very large appetite, she only weighed 50 kilograms. And she had a tremor in her hands, and she had muscle weakness, diarrhea, palpitations, and couldn't sleep. So you can see that overactive thyroid, it affects so many parts of your body. It's not very pleasant. She was on a drug called neomercazole, which blocks the thyroid gland. But it wasn't really controlling her symptoms that well. So here are her blood tests, which are quite interesting. You can see that her thyroid stimulating hormone is 0.02. The normal range is 0.27 to 4.3. So it's way low. In other words, it's suppressed because her thyroid hormones are too high. The T3 is 11, it should only be up to 8, and her T4 is 28, should only be up to 22. So because it's too high, it's suppressing the thyroid stimulating hormone. So we can see that her thyroid receptor antibodies, the TSH antibodies, are 8.5, they're elevated. Should be less than 2.1. So she has a classic Graves disease, and it's not really being controlled by the neomercazole drug. And to get these blood tests back to normal, she would need to take bigger and bigger doses of neomercazole. So, you know, a lot of people do that, and eventually they find that it doesn't work any longer and they have to have fairly dramatic treatment. So Natalie had been told that if the neomercazole didn't work, she would have to have her thyroid gland irradiated with radioactive iodine, which would destroy the gland completely, and then she would have to take thyroid hormone for the rest of her life, which is no big deal, but she wanted to try and hang on to her own gland. She wanted to give it a go. So I said, okay, I'll help you. And what was important in her case is that she had a family history of autoimmune thyroid disease. She had a very high level of antibodies attacking her gland. She had a very high-powered job, which was overtaxing her emotionally and physically. She was highly stressed. She had a high intake of caffeine, sugar and cigarettes so that she could keep going in this demanding job. And her diet was quite deficient in natural anti-inflammatories. Okay, so I said, okay, well, let's try a natural program. So what we did, we gave her a supplement of magnesium ultrapotent, which will calm her nervous system and reduce her fast heart rate. We gave her some selenium to reduce the high antibodies attacking her gland. We gave her natural anti-inflammatories, selenium and NAC, and vitamin C. I told her to do some raw juicing. She did have a juicer, but she was so overworked she never had time to juice. So I told her, well, you can make a whole week's supply, and as soon as you've made it, freeze it in glass jars, and it will last for months. And so she did that. I told her to give up the stimulants, the caffeine, the cigarettes and sugar, and I told her to take a good holiday, and gave her a sickness certificate because she really wasn't able to work efficiently. Well, Natalie came back to see me after her 12 weeks holiday, and she'd spent the whole time concentrating on her health, relaxing, sleeping, exercising, and it actually took her quite a long time to unwind. And she managed to quit the cigarettes, which is great, because, you know, smoking is very toxic to the thyroid. She had a suntan, she gained some weight, and her pulse rate was much lower. She was still taking the neomercazole, and she was hoping that a specialist would be so pleased with her results that she'd be able to start reducing the dose and it would start working. So that was a really positive outcome, and she was very grateful to me, particularly for the fact that I had insisted she take leave from a highly stressful job for medical reasons. And she got to understand that her health was her greatest asset and not the glass ceiling that she was trying to crack at work. So, you know, this case history illustrates the fact that autoimmune thyroid disease can be greatly aggravated or even triggered by severe emotional and physical stress, and it's just not worth it. So I hope you've enjoyed those case histories, and we'd love you to email us and let us know what you thought. Stay in touch with us at liverdoctor.com, and if you have any questions, email us at support@liverdoctor.com. We love to get your emails, and thanks for listening.